Today, we're talking about a very important topic, and that is dealing with mental health issues and anxiety in these trying times. We have an esteemed panel gathered for you, and we will be taking your questions as we deal with this very sensitive issue that unfortunately is exacerbated in times like these. I'd like to introduce our panel, and we're going to start with Dr. Charles Barrow, Jr., and he is the Chief Medical Officer for Aunt Martha's Health and Wellness. And we're also joined by Dr. Wanda Parker. She is the Clinical Director for Aunt Martha's Health and Wellness. And we're also joined by Dr. Willie Mae Jackson. She is an adult and forensic psychiatrist. Ladies and gentlemen, we welcome you to the program. I guess I just want to start by talking about an overall picture in terms of how should we view the issue of mental health during these trying times of COVID-19. We'll begin first with Dr. Barrow.
Yes, good evening, everyone. My name is, as you mentioned, Charles Barron. I'm the Chief Medical Officer for Martha's Health and Wellness. The overall picture of mental health, especially in the African American or people of color community, is something that we seem to kind of try to ignore just from a cultural standpoint. And we have to really start doing a better job of identifying the risk factors, as well as identifying those people who are exhibiting some symptoms or signs or symptoms of certain mental illnesses or depression, anxiety, and so forth. So I think it's just really developing a community awareness for behavioral health concerns.
Dr. Jackson, what is mental illness in terms of from a medical perspective? Because sometimes people say, I may be feeling blue or I'm feeling down. What is the real clinical definition here? So that way we have something to build upon.
Sure, and that's an excellent question, and good evening, everyone. And again, thank you for having me. The most important thing we have to recognize from a clinical standpoint, from a medical standpoint, on what mental illness is simply understanding that mental illness can evolve from having just a symptom to actually establishing a diagnosis. And the establishment of having several symptoms to a diagnosis is based on the impact it's having on an individual's life in multiple compartments of their life, occupational wise, socially, personally, their interactions with other people, and how they are not only perceiving themselves, but how they also are perceived by the world through their own lens. And at that time, when it gets to the point where it's also unbearable and also at times leading to dangerousness, such as thoughts of self-harm or harm to others, this is when we have to address it from a clinical standpoint and recognize the symptoms that lead to this evolution of having a disorder, so that we can prevent certain disorders as much as we possibly can, but most certainly be able to have access for individuals to have access to care if they are concerned whether or not they are maybe experiencing major depression and or just need to speak to someone to make sure that they are not in this position where it is getting to the point where it's becoming a disorder and not just several symptoms based on a trigger or a stressor such as COVID-19.
Talking about those stressors, Dr. Parker, have you seen an increase in terms of people coming into the Aunt Martha's Health and Wellness saying that, hey, I just can't cope. I may have some suicidal ideation. I just feel as though, I can't deal with this.
So we've seen an increase in not only new people experiencing those symptoms of anxiety or depression, but also those people who also already had those diagnoses have more exacerbated symptoms then. So their anxiety has worsened or their depression has worsened as a result of the COVID-19 and the fears that come with either contracting it or someone in your family being impacted by it, the financial impact that it has, the social distancing, which can be isolative. All of those things are stressors.
Dr. Barron, take a few minutes, if you will. You've done extensive research for this presentation. And what is it that you really want to get out? Take a few minutes to stress for our viewing audience on Facebook Live. You're watching the 100 Black Men of Chicago's COVID-19 pandemic town hall, dealing with stress factors and anxiety and depression during these times of COVID-19. What is it that you really want to get across?
Well, again, I think that we look at our community as a whole and the traditions and the culture of our communities and people of color and the African American community. And it's about really embracing this and understanding that, we have to allow ourselves an opportunity to really say, okay, something is wrong. I'm not feeling well. I'm not feeling right. I feel anxious. I feel nervous. Just be honest with yourself. You know your body's better than we as physicians or as clinicians know it. And so you can identify or really tell when things aren't just really, you're not yourself. So just recognize those things. We have to take away those stigmas of, that makes you weak, or there's a certain amount of loss of control if you accept and reach out for support and help. So we want to reach out to all of our communities and just say, hey, we know what's going on. This is a stressful situation for everyone. And we have to, in order to address it, we have to first start to try to identify these things or recognize the differences and then reach out for support and help. And it's okay to get help.
Yeah, it definitely is okay to get help. But Dr. Jackson, there seems to be a reticence many times in the Black community, particularly among Black men, to say that, hey, I'm not bugging right now. I'm just dealing with it.
Yes, well, I think it's important, just like Dr. Barron mentioned, first is reducing the stigma, okay? And what I tend to find in the clinic is, and not just in the clinic in the community setting, but also in the setting, but also in the prison population. Yeah. This is about reducing stigma to individuals that have an existing mental illness, and also reducing the stigma for individuals who are exhibiting symptoms, again, that can evolve into, major depression, generalized anxiety disorder, PTSD. This is about recognizing that it is okay to have an emotional response. What we're seeing right now, especially with young African-American men in the community and in prison settings, is a ton of self-medication with illicit drugs and also alcohol. So in some ways, they are addressing the issues that they're having emotionally by self-treatment that's not healthy. And we've seen this over time and time again, where, reduced access to care and mental health, such as community clinics, even hospital settings, closing of inpatient psychiatric hospital units in quite a few hospitals throughout the Chicagoland area, throughout the country. So if we are not providing the necessary resources, as well as talking about it and saying, hey, it's okay as an African-American male to say, I'm sad. It's okay to say that I'm upset. But what I also tend to find is if someone acknowledges this to somebody, and let's say they have a history of depression, then you have individuals say, oh my goodness, they're having a mood swing, they're irritated, are they taking a medication, are they doing this? That is not helpful. That is also contributing to the stigma. And it's not necessarily intentional. It's just an unconscious reaction that I think that has, so many implications and so many etiologies to that type of perspective and outlook. So we have to be on the front lines, just like we are in these emergency rooms. We're dealing with COVID-19. We need to be on the front lines, in the hood, on the blocks, trying to see how we can help these individuals and get them the resources that they need so that they're not engaging in self-harm behavior, not just by maybe physical, such as cutting themselves or doing things of that nature, but the self-harm and the drug use and not taking care of themselves, not eating well, etc.
And during times like these, not following the guidelines that are set forth by the medical professionals. We're supposed to stay in place, and we're supposed to practice social distancing, and we're supposed to wear masks. You find so many Black men and Black women saying that, hey, you know, I only live once, and life isn't that great to begin with right now. So why am I going to follow something where I think it's a system that's built up against me?
Sure.
Dr. Parker?
Yeah, so I agree with that. I think that, you know, a lot of times it's hard for us to understand why somebody wouldn't follow it, because you're seeing so many cases of COVID-19 and you're seeing also deaths as a result of COVID-19. But I think the perspective that I think is important, especially for our people in our community, is that they have struggled through a lot of stressors and they haven't had access. And so for some of our younger folks, they see this as just another challenge or struggle that they have. It doesn't weigh heavier for them. Yeah. And so I think some of that is about going to them and giving them some level of education. But then on a bigger scheme, we have to really think about how we can really reach out to those communities and deal with some of the generational trauma and systemic trauma that exists that cause for them to even become dulled or numb to crises like the ones that we have right now.
You know, the committee that put the series of town hall meetings together went through an extensive dialogue to come up with a PowerPoint that I'm sure we'll make available to those that are watching not only on Facebook Live, but also at our 100 Black Men of Chicago site. I just want to go through some of the first slides there, if you will, for me, Wanda, if you can pop a few of them up and have you guys actually address some of the issues that are brought forth in this extensive research that we conducted with the 100 Black Men of Chicago. So of course, we're having the mental health in the midst of COVID-19, handling isolation, depression. The great majority of reactions are ordinary human reactions to extraordinary events. So when we talk about human reactions to extraordinary events, what are we talking about, Charles?
Well, you know, we have a response to, just by nature, we have a response to every event that occurs in our lives. And in this instance where we're talking about the COVID-19, such a crisis or a pandemic, it's about, you know, you're going to have a reaction, you know, you're going to respond, but it's about how you respond. And so that's where we are, is looking at or trying to support people in their responses, because it's not necessarily that your response is wrong, you know, because you're responding based on your history or your own experiences. But we want to make sure that we're helping curtail those responses to make sure that they're not dominating your life, or you fall into a depression or fall into some anxiety or illicit drug use or anything's trying to cope. So identifying those things, providing support around you, and helping you cope in a proper manner.
Sounds good. Let's go to the next slide, please. It says the necessity of physical distancing may undermine the very social support needed to get through the crisis psychologically unharmed. This is a distinct reality because, unfortunately, and you know this, Dr. Barron, the fact is that people cannot grieve, nor when their loved one is in the ICU, they can't even go up there to see them and to say goodbye.
Right.
How is that impacting people, Dr. Jackson? The fact that the traditional means that we had in terms of support, getting together around the table, talking about someone we may have lost, actually hugging each other, we can't do those in this age of COVID-19.
Yes, and you know, obviously we're dealing with this pandemic. This is something that is extraordinary for everyone worldwide. And, you know, it is very troubling and it's very difficult for individuals to feel as though they can grieve appropriately, meaning they can say goodbye. You know, there are 5 stages of grief, and we have denial, anger, bargaining, depression, and then acceptance. And the reason with having you know, these 5 stages is that it helps us to recognize and understand who, you know, the person that we've lost, and, you know, how much they meant to us. And then socially and culturally, how we all grieve. Families are different in how they do that. And this is very, very difficult. You know, at this time, I think more than ever, it's paramount that we recognize our support system and communicate. We can talk about the loved ones via FaceTime or, you know, Zoom, and, you know, just try to think about things that you can do, get creative, different ways that you can honor your loved one. And when this pandemic has settled and it's safe, and, you know, no more cases new cases are coming and individuals are getting better, no new deaths, then absolutely it's going to be important to make sure that individuals who have lost loved ones get to celebrate their life and also continue to grieve and mourn and move forward in their own special way.
Dr. Parker, let's go to the next slide, please.
We kind of talked about the grief and loss.
Okay.
So, I'm sorry.
That sounds good. No, hey, that's why we're here. And I wanted you to kind of like dovetail off what Dr. Jackson just talked about in terms of the role that patience plays. Before we get to the American Psychiatric Association's national poll, I want to talk about the role of patience, because many times, especially young people, we live in a microwave society where everything is instantaneous. And yet everything that we're doing nowadays revolves around patience, revolves around the marathon as opposed to the sprint.
Yeah, so I think that, you know, this definitely has been trying for people's patience, and we didn't really kind of see it coming at this degree. So you have parents that are trying to homeschool while they're also dealing with their own stressors financially and employment, and then being able to have what they need. So all of that is very difficult. I think that the only way you really can develop patience is by being patient. So yeah. I think that during the process of people waiting it out, I think the important thing is kind of practicing some mindfulness then. So how can you focus in on the day and the things that you need to get today, the things that are important, gratitude, and not focus too far in advance, because that increases the level of anxiety and fear for people then. So how do you stay in the moment and deal with what you need to do today? And then tomorrow, you'll worry about tomorrow then, because otherwise it just becomes too overwhelming.
Is there anything that you can recommend to aid people to stay in the moment?
Well, I think that being able to have that time with our families and really focusing on what we're grateful for and making it through this moment, those are some of the things. But I think we also have to take a break from the intensity, because I think that we get information overload from social media, from the news, from our families. I have family members or friends that text me updates every, all the time, every few minutes, every half an hour, every hour. It's information overload and it's overwhelming. And so somehow we have to disconnect from some of that so that we can really take a pause and really be in the moment, because otherwise it becomes so overwhelming with all this information and facts, and some is not true and some is opinion, and it's just too much, and we can't handle that kind of overload.
And we'll probably come back to visit what we just talked about, but I want to go here to the information that people are viewing online during our chat here on Facebook Live. It talks about challenges for healthcare workers in a pandemic. People are anxious about the possibility of getting COVID-19. 48%. I would anticipate that number to be even higher. People are anxious about becoming seriously ill. There's a serious impact on mental health in terms of 36%. Serious impact in terms of our day-to-day lives, 59%. People are having trouble sleeping and fighting more with a partner, trouble concentrating. These are all of the challenges that healthcare workers face. And I guess I want you to talk about, Dr. Barron, in terms of just when you're out there on the front lines, you're facing this virus every day, many times without the appropriate weapons to battle it. I'm sure that that has to weigh heavily on the mind of our first responders and those on the front line of trying to keep some sense of normalcy in these trying times. Charles?
Yes, absolutely. And first and foremost, I'd just like to thank all of my colleagues and the frontline staff that are out here, you know, continuously working hard for the communities. And so, you know, these are our true heroes. And I just want to first, before I even get into this conversation, really thank them and, you know, just really say that we appreciate everything that the frontline staff is doing, as well as the first responders and the providers that are on the front line. You know, it's coming from a leadership standpoint, you know, we continuously try to support our staff, support our providers, and having conversations with them to let them know that we, again, definitely appreciate them, but also we understand what they're going through, because they have to think about, yes, you know, I signed up, quote unquote, to provide these services, and this is what being a healthcare provider is about, but also they have to think about their own lives, you know, not being able to go home if I'm exposed, or I'm in the front line and I'm not able to go home and hug my child when I first walk in the door.
Isolation. I didn't see anything in terms of isolation on this.
Right.
In terms of,
yeah, and you know, isolation and just your life, your whole life changes too. You know, we're very focused on taking care of our patients, but there's also a significant impact on our lives as we come home or we go to our day-to-day lives. And then there's the risk of us also, you know, as the data said, possibly getting infected or possibly having a severely adverse outcome. So there's a lot of thought process that go through this, but we have to help our frontliners understand that, again, it's okay to acknowledge these feelings and these concerns and reach out for support and help. And it's important, as from a leadership standpoint, as a chief medical officer or administrators or what have you, to understand that and to, you know, just sometimes ask, hey, how are you doing? How things are going? How things are going at home? And do you need any support? Can I help you? So just, you know, just giving that encouragement, but also giving that acknowledgement that we're here to support you as well.
Dr. Jackson, a classic case in terms of what we're discussing right now with this whole sense of physician heal thyself in the midst of these trying times is the case of Dr. Lorna Breen. Dr. Breen was an emergency room physician in New York City. She contracted the virus, was able to recover from it, and then she went back to the battlegrounds, to the forefront there, back into the ER. But it got so overwhelming for her that she ended up committing suicide. How do we prevent tragedies like these happening to more healthcare workers, as they're not given the proper protection nor the proper mental support that they need to address fighting something that can't be seen? And sometimes it seems as though you take one step forward and two steps back.
Absolutely. And, you know, again, like Dr. Barron mentioned, you know, I want to most certainly give my thanks to all the healthcare providers that are on the front line. We need to recognize and appreciate at the same time that healthcare providers are the new trauma population. We have to recognize that, you know, not only are they the new trauma population, but they're also physicians, nurses, respiratory therapists, you know, people that are actually dying that have been providers. And you made a very good point and actually kind of answered the question that we have to have the appropriate resources for providers, people on the front line, to do their job. We have to make sure that their safety is paramount, because if they're getting sick, then you have less providers. So you still put a burden on the system. You know, we have to make sure that not only are we, you know, checking in and asking people how they're doing, but sometimes we have to go even deeper than that. We have to observe how they're doing. Because, you know, people can say, I'm very fine, I'm doing well, but their behaviors and actions say totally different. So we have to be mindful of the overall perspective, the overall understanding of the individual, what's happening with them, not just, you know, how's everything at home? And like Dr. Barron said, do you need anything? What is it that I can do? From an organizational level, the hospitals, you know, where healthcare providers are on the front line, they have to continue to advocate. And, you know, we are innate we have an innate level of empathy. We all do. And as providers, we want to continue to help. And you have feelings of guilt if you're not able to help, if you're sick. So we sometimes forget to take care of our own selves. So as long as we have the support from the organizations in which we are working under to be on the front line, and we have individuals that are checking in on us and actually making sure that things are okay and monitoring different behaviors that are opposite to what they're saying. This is just about being hyper vigilant and making sure that we are protecting the people that are protecting others.
Sounds good. Let's change to the next slide, please. So we talk about significant shares say that COVID has a negative impact on their mental health. I want to go right down to the bottom there, and that is parent of a child who's under the age of 18. What the heck are we to tell them? We pride ourselves as Chicago's premier mentoring organization, but yet we don't even have the ability to mentor the individuals that we normally would because of the parameters of social distancing. So where do we go, Dr. Parker?
Well, I think we got to be a little bit creative, like Dr. Jackson said then. We do have social distancing, but people need those social outlets, right? Those are the things that actually keep them going. If we didn't even have the COVID-19, those are the resources and support systems that kept them going even before then. So of course, during this time, they need them more than ever. So I think we just have to be creative with that. So if that's using Zoom to be able to have a family gathering or do a virtual session, teletherapy, telehealth, being able to utilize those resources so that you can get what you need right now in this hard time, because you don't have to suffer it alone. And I think that's the message that we need to be constantly telling everybody, all the people that are on the front lines, all the people in the community, is that you don't really need to suffer alone. Being able to have those resources. I have patients children that are doing violin lessons through Zoom, or karate lessons through Zoom. So, if we can in some way lessen the impact, especially on our children, so that they can have as normal as it can be, even in this time, to be able to have that routine, that's important then, because then they don't feel the impact as much as if all those things were removed from them.
Wow. Let's change the slide, please.
Okay.
Prevent mortal injury. This is extremely important here, only because April is National Child Sexual Abuse Prevention Month. And the reality is that those mandated reporters, people that are like mentors, youth ministry directors, teachers, doctors, all of those support services that existed to see whether or not a child is suffering physical abuse or maybe suffering from sexual abuse, there's no contact there. And so how do we deal with that in light of the fact that a child may be in a situation where they're confined and have no way out? Dr. Jackson.
Yes, that's a very, very challenging question that has multiple answers. It's obviously important to have access to care. And with having the social distancing, stay-at-home orders, it makes it even more challenging to be able to protect individuals that are staying at home, particularly children. As far as, mandated reporters and other individuals that work in social services, again, it's about trying to be creative on how we can still get the job done, but try to keep everybody safe. And that's not a static entity. It's ever changing. We can develop a protocol this week, and next week we need to change it because maybe it's not working, or unfortunately something has happened that we need to immediately deal with it and resolve it. But, I'm hopeful, and I hope that individuals, particularly children, can have some level of supervision or protection, even if it's not someone in the home, as long as they have someone checking on them. That's what this is about.
Check on
them.
And I say that because I've been mentoring for some 30 years now, and the reality is that when I'm in my Saturday sessions with, these young boys, I have to look at them and I ask them, I'm able to see them. I'm able to see how they're interacting. I'm able to look at their face. And if I see a scratch on that face, I'm immediately going over to that young man, that young boy, and say, hey, how did you get this scratch?
Right.
And they'll say, well, I was fighting with my cousin. Well, listen, I don't want you fighting anymore, because if I see something and I see it looks worse next week or something like that, I'm going to have to report it.
Yeah.
Mm-hmm.
And I think that talking about implementable solutions for the people that are joining us right now, one thing I see is that when we do engage in Zoom conferences and FaceTime, have them get right up into that camera to look at them.
Absolutely.
See whether or not they smile. I'm not the clinician here, but just being able to look at a kid, you could see whether or not they've been a victim of abuse, at least on their face, if not, their neck or so.
Yeah. So, Daryl, I'd like to chime in on that. As one of the components of our organizations, we deal a lot with youth in care. We also deal with foster care and intact families and things of that nature. And so we had to, go to the quote unquote powers that be to just talk about, hey, how can we continue to engage these youth? How can we continue to engage these families during this crisis? And we had to really promote and advocate for televisits and being able to FaceTime or Zoom our youth and our clients just to make sure that they're okay. This is our way of just having that some level of accountability to take care of these the vulnerable population that we serve. So, I definitely 100% agree with what we're talking about here is that we have to figure it out, and we have to get managed care organizations and other organizations on board with us that, we can't, maybe it's not safe to go into the homes, or we have to do some screenings before we even go into the home. Do we have the proper PPE to go into that home? But if not, what else can we do? And that's through televisits and different things of that nature. So we've really been advocating a lot for that, and we've been somewhat successful, I would think, when you say, Dr. Wanda.
Yes, yeah, definitely. And there's still times when they do have to go in the home after screening because they're a high-risk case. So we can't forget those moments just because we're having COVID-19, that there were other crises that came and that people are still dealing with and families are still dealing with.
I know organizations like the Chicago Children's Advocacy Center are extremely concerned because the numbers of incidents are way, way down, but yet conversely, we know that these kids are in situations where, because there were mandated responders and reporters, those incidents were able to come to light, but now they're kind of hidden behind closed doors, so to speak. Let's move on to the next slide, please. Psychological distress, the increased challenges. Talk to me in terms of what is PTSD, Dr. Jackson?
Sure. So PTSD is the acronym for post-traumatic stress disorder, and it is a component of a category of illnesses where we call now trauma-related illnesses. And PTSD is not a diagnosis necessarily that an individual would have initially. So PTSD is a disorder that evolves from initially having an acute stress reaction, right? We have a stressor, a trigger, and it causes various symptoms. We're looking at different categories of an acute stress reaction that changes into PTSD, such as hyperarousal, individuals that are easily startled, your mood changing. We're looking at difficulty with sleep, nightmares, re-experiencing the traumas all over again. And, individuals can develop an acute stress reaction that can go into an acute stress disorder, meaning they've been exposed to a stressor, they've developed psychological distress within 30 days time, and they're no longer in an acute stressful state. But then individuals that remain in acute stressful states that go beyond 30 days, now this is considered post-traumatic stress disorder. And it does have an impact on on an individual's life. It has an impact on their families. And overall, it's important to recognize what the triggers are, because we don't necessarily want individuals re-experiencing these various traumas. But keep in mind, PTSD itself does not have to happen within a month's time after a stressor. You can develop post-traumatic stress disorder 10 years from now for something that happened 10 years ago. So as long as
that may be the case in terms of what we're going through right now.
Absolutely.
Because we're, you know, that fight or flight kind of syndrome we're taught to maintain. And then a few years from now, we wonder why are we in the state that we're in, and it can be possibly traced back to the times that we're going through right now.
Sure.
Let's change the slide. Compassion fatigue or secondary trauma. I think you kind of talked about this a little bit there, Dr. Jackson.
Mm-hmm.
Is anything else you wanted to add to that?
Well, I think it's important that we recognize not just individuals on the front lines, but we recognize the caretakers of individuals who are not doing well, the caretakers of individuals and loved ones of individuals that are, you know, dealing with family members and loved ones that are in the hospital due to COVID-19 or due to other medical conditions, and just, you know, feel overwhelmed. It's important to recognize when you are in such stressful states of worry, and it impacts sleep, it impacts mood, it impacts your energy and your outlook. It's important to recognize that you have to sometimes take a step back and establish self-care. If you don't, then that chronic, you know, the compassion that you have for individuals, the selflessness, that can transition into having mental illness. It can transition into just feeling sad or just feeling as though things aren't getting better, and creating a non-optimistic outlook. So it's important to be able to care for people, loved ones, patients, etc. But it's important to recognize what your emotional barriers are. And when you have to take a step back and say, I need to work on something for myself, because now I'm losing sight of what I need to do for myself.
Let's change slides.
It's a little more.
Yeah, it's kind of, we talked about that. Let's move on to the next one there. Prevention and intervention, taking care of yourself, which is what you just talked about. Dr. Barron, I want you to talk about the necessity of capacity enhancers, exercise, wellness, nutrition, mindfulness, meditation. I know that I had got off my practice in terms of my normal routine with regard to cardio and yoga. And, but now I'm back on it, which is good. But, you know, being away from being able to go to the why kind of hit me for a loop. And, you know, I saw myself kind of going back to areas that I didn't want to visit.
Right. Yeah. So definitely things in terms of like exercises, eating properly, just meditating, or doing whatever you used to doing to kind of maintain your mental wellness is very, very important. You know, we're sitting in the house probably more than we've ever sat in the house before, and you find yourself eating and snacking with the kids. And, you know.
Well, should we try to put on that old suit and realize that it doesn't fit? That you haven't put on in about a month and a half, and you bust a button on the waistline there?
Absolutely, absolutely. So, and it's important. And then, so that leads to even more depression, right?
Yes.
So, you know, it's
I'm still eating a Snicker. Yes.
Right. And what's the potato chips? You just can't eat just one, right?
I really want either, you know, Dr. Parker or Dr. Jackson or yourself, Charles, to talk about this, because the #1 seller at grocery stores now and supermarkets, walk down the aisles when you have to go, you know, to do your monthly, hopefully, or bi-weekly food shopping, and the shelves that are always empty are the ones that have the potato chips and the snacks. No, it's realistic. It's real.
A lot more alcohol too being sold.
Well, they keep that well stocked.
That's for sure. You know, I think that, you know, one of the things that Dr. Jackson said earlier is that, you know, you find people self-medicating. So it
Yeah.
can be with those type of things. It can be with alcohol or drugs, right? It's a coping mechanism. It's not a healthy one, but it's a coping mechanism, right? So we need to be able to be connected with those things that are healthier, you know, that are going to help our immune system, but also make us feel better. Because people do want to feel better, and we understand that, right? We want to be able to deal with the level of anxiety and the stress of the COVID-19, but we want to deal with it in healthier ways that won't cause for us to have more pushback or more issues as a result of the COVID-19.
You know, one capacity enhancer that I see here, and I would list it under support, is that the role that prayer and faith plays in all of this.
That's right. Yes, there's definitely a spiritual component, and I think that probably some people who haven't prayed for a while are doing more praying now too,
Yeah.
right? But I think that a lot of times these are the things that kind of usually draw us closer to the people that we love. The fact that we have the social distancing creates a little bit of a barrier with that then, right? Because people will go to church more often when they're in crisis, but they can't do that now. So a lot of those outlets that we use to get closer to God, to get closer to the people that we love, have been a challenge right now.
Yeah. Let's move on to the next slide, please, and then we'll open it up. Self-care and wellness, be intentional, redefine self-care as a unique experience, consider psychological spiritual wellness. Okay. Who is the author of the psychological spiritual chapter?
Well, I think in essence it's saying that we need to look at what we need, and we have to take the time to make sure we get what we need. And I kind of compare it to a gallon of water, and you're pouring and helping somebody there, you're pouring and helping somebody there. Eventually the gallon is going to be empty. Are you taking time to refuel? Because that's what self-care is refueling then. How do you do, if you're on the front line, whether you're working in the grocery store or you're a healthcare worker, what are you doing to refuel, to replenish that? Because that's how compassion fatigue happens then. It's when you're empty and you've given everything and you haven't taken the time to give back to yourself.
I like the analogy, Dr. Jackson, of something that all of us haven't done in quite some time, and that's air travel. And they always tell you that in the event of an accident and the oxygen tubes come down or oxygen bags come down, to first put it over yourself before you try to put it over your child.
Absolutely. And, you know, it's important to recognize and apply this. It can be very, very challenging because we want to help the people that we love. We want to help patients that are on the front lines, even when we don't have anything to give. And sometimes we have to still do what we have to do when we don't have anything to give, because sometimes that's just how it is. But it's important to recognize I need to take a step back. And sometimes you just need to stop. I'm sure we've all been in a position, regardless of the circumstance, whether or not it was extreme or, you know, minor, where we've said, you know what, I'm good. I'll see you all later. I'm done. And we have to make sure that we continue to have that self-preservation of self-care, physical, emotional, spiritual. We have to make sure that we still have a percentage of that for ourselves, because if we don't, then we will burn out faster than we need to. And then we're also putting ourselves in a position where we're not living a good quality life for ourselves. And we have to practice what we preach sometimes.
Indeed. Let's move on to the next slide. And it talks about seeking self-support or support. What organizations are out here in terms of support? And what we will do is that we'll compile a list that we'll post on our website of organizations that people can turn to that are seeking help. Of course, we know the National Suicide Prevention Hotline. In fact, we already have that resource already up in terms of the Physician Support Line, the National Suicide Prevention Lifeline, the National Suicide Prevention Lifeline in Spanish. We also have the Crisis Text Line. This is very important, which is text hello to 741-741. And also we have two esteemed experts from Aunt Martha's Health and Wellness, and their number there is 877-692-8255. 8686. That's 877-692-8686. And those are resources. We will have these resources available on the website of the 100 Black Men of Chicago. I think that's the last slide there, Dr. Parker.
Yes, it is.
Yeah, so let's go back to showing the people, you guys' beautiful faces, not mine, but indeed. And I really want to take this time because so much focus has been spotlighted on those first responders. But the reality is that the people that maintain a greater degree of normacy for us are those people that are essential workers, the clerks, the auto technicians, the gas station attendants, the people at the cleaners, the people at the restaurants that we visit to get takeout. Those people are going through, and many times at a lower pay scale, unfortunately, than our first responders. You know, and I love all of our first responders, and believe me, I pray for them, and I think that they do a yeoman's job. But I think that we have to be balanced in our approach to understanding that these other essential workers are putting their lives on the line. Look at the explosion of COVID-19 infections among people that are working in the meat plants, so much so that the federal government is talking about intervening there and forcing them to work under these intolerable situations. Dr. Charles Barron.
Yes. So definitely we have to think about those frontline workers and essential workers, and also do the same, you know, make sure that we're doing wellness checks. And I think even from a management standpoint, it's important that the managers and administrators or whoever the leadership is of those different organizations are paying close attention to those staff members and asking questions, again, checking on them, just noticing, as I think Dr. Jackson mentioned, notice their behaviors, you know. Is this staff member as jovial as they usually are? Is something going on? What's going on? What's happening with you? You know, so we have to really do that. And I mean, you know, and they have to be creative and I'm speaking from a leadership standpoint because this is what I'm going through right now with our executive team. And is that we have to make sure that we're reaching out. We're doing things, putting a special effort to give recognition and acknowledgement to those frontline and those staffers and those essential workers, and make sure that they are taking care of themselves. I mean, we're even promoting, hey, you know, you have vacation time. This may be a good time to take a little bit of your vacation so that you can kind of rest and restore yourself and get back into the, the swing of things. So I think from a leadership or management standpoint, is really important that we recognize those staff members and try to help them help themselves.
Yeah, indeed. And as we try to help those that are in need of help, how do we do a self-checkup, so to speak? Because many times we like the fact that, you know, we're able to cope with situations, but we don't want to face the kind of shame of saying that I need help. Dr. Parker.
So I would say, firstly, we have to be good stewards of what is there. You know, a lot of times we give good advice to other people, but we don't take it ourselves then. Sometimes we'll feel like if I'm not there, things are going to fall apart. And it may be an emergency, but guess what? If you don't take care of yourself, things are going to fall apart anyway. So I think that we have to be able to take the time to reach out for help. It's not a sign of weakness. It's actually a sign of strength when you ask for help when you need it. And I think we just have to really kind of rewrite that narrative that, you know, it's something wrong with you. We get offensive about labels, and none of this is about labeling. This is about receiving the help that you need, asking for help because you need it. And just like if somebody asked you for help, you're there like that, split second. So you need to be able to access those things too. I think sometimes we are those heroes, right, that are on the front line, but we take it to another level that we don't actually need to be able to have help and reach out for help and take time away just so that we can refuel and be able to do the stuff that we're doing every day.
One segment of our population that are in fact sheroes are Black women. A colleague of yours and a good friend of mine, Dr. Carl Bell, I would have him on my radio show many times, and he gave me some startling statistics when it comes to Black women and health. Black women, if I'm not mistaken, Dr. Jackson, actually have the lowest suicide rate among any ethnicity or population, if I'm not mistaken.
Correct. This is true.
What is it that enables these women to cope? And why don't we, just like we're trying to get the blood or the antibodies from COVID-19, maybe we need to get something from the spirit of these Black women that are able to deal with this trauma and instill it in ourselves.
Well, first and foremost, I must admit, and I'm sure Dr. Parker and Dr. Barrett can agree, we don't have enough time to talk about the evolution of the power of the not during this section. We don't have the time.
I agree.
I'll give you a small synopsis of it.
Go ahead.
I think it's important to recognize too that we are innately accustomed to taking care of the house, right? Yeah. We are always making sure that the kids are okay, significant others okay, family members okay. And sometimes when you are so consumed with caring for other people, especially African-American women, when these are roles that we have been accustomed to playing and doing, it's difficult to, and I've had many patients say to me, African-American women, I don't have time to think about that. I think about people that need me. I can't have those thoughts, or if they do have those thoughts, they're short-lived because they recognize the importance of their role within the dynamic of their family, in their community, with their friends, with relationships. And we're just resilient and we persevere. And we recognize that, sometimes it gets difficult. And sometimes, we may react or emotionally react to things a little bit more intense sometimes. But I think we are entitled to that because those types of outlets, whether or not they are healthy or sometimes unhealthy to other people, we need to get it off our chest, so to speak. And that's what a lot of African-American women, have done throughout time and just been able to carry the weight of so many different adversities on their shoulders and the importance of their role in not just their household, but also in society.
Incredible. A couple of questions from our fellow members there. Tyrone Studemeyer wanted to know, what can we do to help young Black men who are impacted by COVID-19? Charles?
Yeah, so I guess, the question would be, in what ways are we talking about we're impacted? But I think young Black men, we have to, again, educate them, first of all, make sure that they understand what COVID is about, what your risk factors are. Because, I know a lot of the information that was out and early on was focused more on
kind of losing you there.
I think comorbidities, and the young people, you are, I'm sorry, I didn't.
No. We had lost you a little bit there though, but you were talking about comorbidity.
Yeah, so I was saying that, initially all the information was talking about seniors and people with comorbidities. And so the younger generations or the younger population were thinking that they were, almost immune to it. It wasn't going to impact them.
I'm super glad it ain't hitting me.
We started to find out that it does impact the younger population. And then the other part about it is, even if you're not having symptoms, you may take these the coronavirus and infect another one of your loved ones, or grandma, or your parents, or your younger sisters and brothers. So we have to really educate and make sure that they understand what your role is in keeping everyone else safe, as well as yourself. And that it's not just a older generation disease.
Yeah. Dr. Parker, question from Jordan Sorrell wanted to know, how do we instill hope in the middle of this pandemic?
I think that's one of the things about us as a people, though. It kind of is alluding to what Dr. Jackson would say. We have this level of resiliency. We know how to kind of weather through crisis. You know, we've been built for it in some respects. So we know how to do it. We know how to maneuver it through it maybe better than some other people do. You know, so we know how to kind of join hands. We use our spirituality. We know how to blow off some steam. And so that's what we have to do is. And I think that one of the things is that we're going to have all these stresses, all the anxiety, but we got to match it with the gratitude then, you know. So we're going to have times we're complaining and that we're sad or we're anxious, but how do we match it with what we're thankful for right now then? I think
I love that word, gratitude, and being grateful. My favorite song, one of my favorite songs is Tremaine Hawkins when she talks about be grateful. When I was a kid, you know, almost every kid that I ran with had holes in his sneakers. And nowadays, you know, people buy shoes and throw them away. And there is so much I think that we have to be grateful for. I don't know what type of psychological impact that has, Dr. Jackson or Dr. Barron or Dr. Parker, but I know a sense of gratitude with even when we're going through hard times always tends to work out well. I want to give each of you about 30 seconds to issue some closing comments. We're going to begin first with Dr. Parker.
So I would say make sure you take time for yourself. I'm encouraging that gratitude as well. And if you need help, don't be afraid to reach out for help. It's probably the easiest time right now. A lot of insurances are waiving copays for teletherapy. So this is a good opportunity for you to do that.
Indeed. Dr. Jackson.
Absolutely. I couldn't agree more. I think it's also important that we get back to basics and understand and appreciate the art of conversation, and also understand and appreciate the simplicity of our emotional states, meaning it's okay to say, I am sad. You know how when you're children, you're taught to say, I am sad, I am happy, I'm frustrated. We need to get back to basics and say it. It doesn't matter how old you are. And when individuals are, you know, expressing their feelings and they're telling you how they feel, look them directly in the eye so they know that you are actively listening, and they know that you are there for them, and continue to give them various resources that they need in the community.
Like we like to say with the 100, what they see is what they will be. Absolutely. Dr. Barron?
Yes, and so I just echo everything that the ladies have said. And, you know, this is an opportunity for us, again, to look at ourselves and work on ourselves, but also enjoy the things that are around us. You know, we have gotten so accustomed to doing things outside and doing a whole lot of other things, but this is an opportunity for us to get closer to our families, you know, even if it's through Zoom or what have you. But even when the kids are home now, you know, I look at it when my kids spend more time at school than with me. But now, now that we're the teachers, I'm like,
going out to here there.
But you know, but it's a time for me to really learn the personalities of my children and to really pour into them, and to, you know, and really spend time with my family and my wife and so forth. And I think that we have to, you know, look at that part of the silver lining of all of this that's going on as an opportunity to really bring things back closer to our, to home and bring it back to us.
Well, I want to thank all of you for your insightful information that you provided today. You have been listening to a COVID-19 pandemic town hall sponsored by the 100 Black Men of Chicago. We truly appreciate you joining us. We will have this conversation posted on our website. If you would like to revisit it, please take advantage of the resources that we talked about. Those resources will also be posted on the 100 Black Men of Chicago website. I'm Daryl Denard. We thank you for joining us, and we look forward to you joining us again next week for another COVID-19 pandemic town hall sponsored by the 100 Black Men of Chicago. Know that patience is a virtue and the rewards are a gem. Stay safe, everyone.